I think they're on this side.
Yeah.
I want to echo that we need healthcare reform. I also want to echo that I have respect for the president for putting himself out there for those policies. But Mr. President, I don't want a healthcare system that reflects what you said. Why don't you just take the pain pills and not have the procedure? Special hi to my healthcare colleagues that are out here. Tell people what it's like to live the rest of your life on pain pills and that dependence that it's caused.
I hate the pain.
For you that are Medicare age, or are going to be Medicare age, I think you look at me and recognize I'm obviously a young Republican. Famous page 425 in one of the proposals packages that says every 5 years you will get a consultation with the federal government counselor relative to your end-of-life decisions. And what that means is most of healthcare is spent in your end-of-life days. What this is saying is you are disposable. Because the federal government, when they establish a single-payer system, will not want those choices at end of life. Why on earth would we ask the federal government to fix the system that they have ruined? Got allergies? It's one of those days. I hope you can tolerate it, okay? I'm only nervous when it's a room full of virgins. Where we are in healthcare, please understand the federal government is why healthcare is so expensive. As a hospital, we have 25 cents on the dollar charges that we get back from Medicare. What we do with that cost is we shift that to employee payer benefit programs. All you small payers, we shift that cost. The way this system is, you will not be able to be paid for the federal government's benefit package. You will opt out, and it will be cheaper for you to pay the penalty to not carry health insurance. And so it's a second tax. So you get a taxation without representation because of the Medicare losses at every hospital in the country. First, shift to the employer.
I appreciate you losing your voice
because you won't be able to offer a competitive benefit package. You will opt out and pay the tax that is in the legislation. And still we'll have a single-payer system. What's going to happen with a single-payer system is hospitals will go out of business across the country on a wholesale basis. I'm very proud of the colleagues I get to work with the Goshen Health System. We haven't had a quality score below 90 percentile since 06. We are the only magnet hospital in the region. That's the highest award you can get for the quality of care that's given in your nursing areas, and what we do for nursing, we do for everybody. Pride, right before the fall, and I think we're looking at the fall right here. When we get to the single-payer system and it's 25 cents on the dollar for every healthcare person and patient that we see,
Absolutely.
it's going to be impossible for hospitals to maintain equality. So, Mr. Obama, you sat across the street. You talked about an urgency for healthcare. We have to pass this by year end. I don't know what your urgency is, but that reminds me that he's running to the finish line. As a track member in high school, notice I didn't say track star. Sounds like he's running a dash. So let's come up with some ideas and offer some options here, the President, to seriously consider, rather than not reading the bill, signing it into healthcare because he has an inflated sense of urgency. I appreciate you all being here. We're expressing our freedom of speech today before it may be curtailed in every arena. Health care reform package. Because Medicare gets a waiver, and we all pay the cost of Medicare, let's have the government pay 60 cents on the dollar, where they pay 25 cents on the dollar. Wow. That's going to put a lot of cash into the healthcare system. Healthcare is local. We have a bountiful number of good healthcare organizations in our region. Let's keep them viable so we have choices on where we can go. That will help the healthcare systems. Now, because they're getting an influx of capital, let's make them responsible for taking care of the healthcare needs. So we know in our community what the unemployed folks are going through. We know through our charity care, through our no-pay care, which is rising. Let us be responsible for our home communities, because still the first reason for picking hospitals is location, location, and location. We got into this business to help people. Let us help in our home communities. We know better than Washington.
Yes.
Get that healthcare influx of cash from 60% being paid by Medicare instead of the 25% that they're paying now. Let's restrict hospitals so you can only make so much. We'll negotiate with you, Mr. President, on what that percentage looks like. It's not going to be 20%. It'll be in the 5% area. Restrict hospitals to that percentage. If they go over that percentage, have hospitals pay that money into the state coffers for the Medicaid population, thus increasing access again.
Yeah.
Our physician colleagues have taken a hard nap, but when you have to pay $100,000 out of your pocket for health insurance because of the tort reform that we have in this country, it's really not fair that the rap that doctors are getting. But let's help them out of the economic pressure and provide incentives for them aligned in a salaried position with hospitals around the country, so they're not incentivized to take surgery. People do surgery with me not needed. Now that is that much of a percent. But because that rap is out there, let's take the doctors, align them with the hospitals. We have a common mission and a common population. Let healthcare workers live out their personal passion mission of why we got into this business.
Yeah.
Of healthcare, and I want to maintain the reporting relationships that we have in the industry so that you have a better idea what doctors and hospitals that you should go to. I'm all for that, and let's set high standards that healthcare organizations have to complete. Those hospitals that are exceeding those profit percentages will have a 3-year period of time to adjust their percentages down to what we would negotiate with the federal government as an acceptable profit to continue with the quality care that we're giving. Let's regulate the insurance companies.
Yeah.
And when we regulate them, let's take out the non-patient-friendly aspects of their insurance coverage, like pre-existing conditions. Cause hospitals to reduce their profits to be in line with the national standards. Phase this program in over a 3-year period and evaluate it against the goals and objectives of quality and access. Ladies and gentlemen, taking an active role in our society as you're doing today humbles me. It makes me feel like I should do more of this. So I appreciate you being out here. I appreciate the young Republicans taking the initiative to have this happen today. Mr. Obama, your popularity is dropping. Right.
Yeah.
Look at what they've done in Medicare. Look at what they've done in Medicaid. And VA also. I've been in the VA system and doing hospital consultations, and I'm not proud of the VA healthcare system. And I also have an honorable discharge. So let's give a second. We shouldn't ask the people that broke the system to fix it. I have the privilege of working with people that call themselves healthcare workers. They have a passion, personal passion. They get into this business. They could be doing more lucrative jobs, but they get into this to help people. What this is going to do is constrain our ability to be able to reach out to our home communities, because we will not have the dollars to give you quality health care What's going to happen is hospitals go out of business across the country. Obama's main objective of increasing access will be reduced as those hospitals go out of business. You will not be able to get into a local facility on a timely basis. So wait for a year while we give you an MRI to make sure that you didn't not listen to that violation. Thank you for asking me to be here. God bless you. Our next speaker needs no introduction.